Good afternoon. Again, it is still Thursday, March 16th, and you should have in front of you voting list number 15. We're going to start with Patrick's bills today and work our way through this. And so Patrick, you can proceed.
Great. So Senate Bill 162 is the first bill under consideration. It's the bill that changes the composition and duties of the Maryland Aviation Commission. The commission's duties would change to require it to establish policies directed toward the Maryland Aviation Administration's ability to best mitigate actual and potential negative impacts of the local aviation and airport industries, as informed by the accepted scientific research on creating and maintaining healthy and livable communities. It also would require it to consider and carrying out its charge input from airport employees or their representatives, local government, citizens from communities near airports, and other Maryland communities that have or are predicted to have adverse health or livability impacts from airport infrastructure and economic growth decisions. And finally, the bill would require each member of the commission to receive an orientation session to educate the member on the commission's dual responsibilities that I described. One, and then the other is to promote the role of BWI as an airport of service to the Washington, Baltimore metropolitan area. Senator Bidle has offered an amendment that is reflected in the reprint. And what that amendment would do is increase the number of members of the commission from 9 to 13 members. Under the bill as introduced, 8 of those members appointed by the governor with advice and consent of the Senate. That wouldn't change. 4 of those members, though, would be from a list of proposed candidates designated by resolution of the DC Metroplex BWI Community Roundtable or its successor organization. And then the amendment that's offered by Senator Bidle would add 4 additional members, 1 member appointed by the senator from the 12th legislative district, who's a resident of the county represented by the senator, 1 member appointed by the senator from the 13th legislative district, 1 member appointed by the senator from the 30th legislative district, and then 1 member appointed by the senator from the senator for the 32nd legislative district.
Okay, first you have before you amendments to Senate Bill 162 that changed the number of members of the group, as well as a couple of other minor changes. Are there any questions on the amendments? Seeing none, I'll entertain a motion. Have a motion for a have a motion for a favorable with amendments and a second. Are there any questions? All those in favor, raise your hand. Okay, that bill receives a unanimous favorable with amendments report. We'll move to the next bill.
Senate Bill 786. I've got a reprint in front of you, so I think I'll just start talking from the reprint on this bill. This is a bill that would establish restrictions relating to the disclosure of information concerning reproductive health care. It's applicable to public records and health information exchanges and electronic health networks. So there's been a lot of discussion and feedback that has gone into the amendments that Senator Hettleman is offering, input from the Healthcare Commission, CRISP, the AG's Health Education Advocacy Unit. So I'll run through them. So if you go to page 2 of the reprint, this is the part of the bill relating to the Public Information Act. And here, public information under the bill here, it would require a custodian to deny inspection of the part of a public record that contains identifying information of an individual related to an ambulatory surgical facility, as well as a surgical abortion facility. And in response to some feedback from the Maryland Healthcare Commission, there's an amendment here that would restrict information except for the owner, primary contact, attorney, or consultant contained in an application to MHCC for a certificate of need or certificate of need exception or determination request. Also, there is a provision in here as amended that would provide, with respect to the holder of a license issued by Health Occupations Board, it would repeal the authority in statute to release the home address of a licensee if the business address is not available. Continuing on to page 3 of the reprint, this is the area of the Health General article that deals with confidentiality of medical records. So moving ahead to page 5 of the bill, you can see that here the definition of the protected information, it's legally protected healthcare. And as defined, that means all reproductive health services, medications, and supplies related to the provision of abortion care and other sensitive health services as determined by the health secretary based on the recommendations of what will be a newly established protected healthcare commission that I'll go over in a little bit later on in this reprint. If you go to page 8 of the reprint, there's some definitions that have been struck, and there's a definition that's been added for sensitive health services, so that this includes reproductive health services other than abortion care. And then this is the part of the bill that really pertains to electronic health networks and health information exchanges. And these are the systems that providers use to communicate information, electronic health information to each other, but also systems. The electronic health networks are systems used for transmitting information between providers and payers of healthcare services. And so if you go to page 11 of 24 of the reprint, and then you can see at the very top of page 12, this would require the Healthcare Commission to adopt regulations to restrict data of patients who have obtained legally protected healthcare. And then this new on page 12, 4302.5, this establishes a general restriction on the disclosure of information through health information exchanges and electronic health networks. Beginning on December 1st, 2023, a health information exchange or electronic health network may not disclose mifepristone data or the diagnosis, procedure, medication, or related codes for abortion care and other sensitive health services that would be determined by the secretary to a treating provider, business entity, or another health information exchange or another electronic health network, unless the disclosure is for the adjudication of claims or to a specific treating provider at the written request of and with the consent of the patient, for which the patient services for which the patient can provide consent, or a parent or guardian of a patient for services where the parent or guardian can provide consent. It's the amendments would delay the penalty for non-compliance by 1 year, so that will be pushed back to June 1st, 2024. The aim of this, as I understand it, is to allow these health information exchanges and electronic health networks to be able to come back to the legislature if they determine that they need some changes to the statutory requirements. And then on page 13, this authorizes the Secretary of Health to determine the codes that are subject to the restrictions on disclosure. And it also, the determination that would be made by the Secretary regarding these codes must follow applicable guidelines of the American College of Obstetricians and Gynecologists, World Health Organization, and the Society of Family Planning. And for these sensitive health services, the determination of what codes would be subject to these restrictions must be based on recommendations of this protected healthcare commission that's established, that will be established. The secretary then has to adopt regulations to restrict the disclosure of abortion care and other sensitive health services information by these codes. The bill authorizes the secretary to adopt regulations that would place restrictions on codes that are applicable only to disclosures by these health information exchanges or electronic health networks to out-of-state treating providers, out-of-state business entities, or other health information exchanges or other electronic health networks. So in other words, the secretary would be able to place restrictions on disclosures of information when it's heading out of state, but allow those that exchange of information between, in these through these networks that are within the state itself. There is one provision here that provides, though, that any regulations adopted by the secretary to implement restrictions on the disclosure of mifepristone data must apply to disclosures of data to recipients located here as well as outside of the state. There is one modification to a provision of the medical records law that relates to when a healthcare provider can disclose a medical record without authorization of the patient. And that's on page 16. And this is applicable to health insurance carriers and accountable care organizations who transmit data relating to care coordination. And the bill provides that if the disclosure of this type of information is of an abortion care or other sensitive health service as determined by the secretary, that disclosure is subject to the requirements of this bill. There is an amendment here that strikes from the bill provisions that are not impacted by the bill because they're unnecessary. So they're being pulled out of the bill. And then on page 17 of the reprint is where this Protected Healthcare Commission is established. The purpose of this commission is to make recommendations to the secretary on the sensitive health services to be determined by the secretary as legally protected healthcare. You can see the composition of the commission here. It includes the Attorney General or the Attorney General's designee, the Executive Director of the Maryland Healthcare Commission or designee, and then the following members who are appointed by the health secretary: a resident of the state who's a licensed physician and nominated by the American College of Obstetricians and Gynecologists, a resident of the state who's a licensed clinician that provides reproductive health care and is nominated by the Reproductive Health Access Project. There's a representative who's a certified nurse midwife, a representative of the Physicians for Reproductive Health Care, a couple members who are consumer representatives with expertise in consumer data privacy, and then a resident with expertise in health information. And this commission will select its chair. It has to meet 4 times a year. The health department will provide staff for it. And as I've described, its charge is to identify these sensitive health services information by these diagnosis, procedural, medication, or related codes, and the codes that specifically would create a substantial risk to patients or healthcare providers if disclosed. In carrying out its work, it can consult with certain organizations that are listed here, and has a requirement to issue a semi-annual report to the health secretary on its recommended sensitive health services for protection. These reports have to include an assessment of the potential risk to patients that would result from and providers that would result from the disclosure. And then within 60 days of receiving these reports, the secretary has to submit a written response that includes its findings and determinations. And this response report must be submitted to this commission, but also to the Senate Finance Committee and House Health and Government Operations Committee. Going on to page 19 of the bill, this alters the purpose of the Healthcare Commission so that it includes establishing policies and standards to protect the confidentiality of patient and healthcare practitioner information related to legally protected healthcare. The amendment would strike from the bill provisions that are not impacted by these new restrictions in the bill. And then at the very end here, there is a technical clarification that makes relating to health insurance coverage for abortion care services that makes clear that the coverage requirements in statute apply to non-grandfathered individual and small group market plans. And then on the uncodified language on the back, we have some timelines that would apply. The secretary has to adopt regulations within 90 days of the effective date of the bill concerning identification of these codes for abortion care. Then within 9 months, the Healthcare Commission has to adopt regulations to implement the bill, regulations addressing some of the operational issues. And then finally, there's a requirement that for a 2-year period, the Healthcare Commission provide regular updates on a quarterly basis to the Senate Finance Committee and the House Health and Government Operations Committee on the status of implementation of the bill. The effective date of the bill would be June 1st, 2023.
Okay, that was a lot of information. Are there any questions? Any questions, Senator Ellis?
Yeah, thank you, Madam Chair. So my major concern with this bill is there's a firewall between a person's medical records and out-of-state government agency. So with the bill and the amendments, is that kind of like solid as far as protected?
Yeah, so I mean, I think this bill is really getting at the electronic health networks that connect providers. And so the way this would work is that, for example, CRISP or, maybe one of the electronic health network systems that's used, by like a hospital system, the obligation would be on them to put in these controls. So when there are these sensitive codes, they would be able to flag them and preclude them from being transmitted without the patient's authorization. So that's really what this bill is designed to do, is to put in that firewall, but it provides the ability of the patient to still provide authorization for that sharing if that's what they want.
Okay, thank you for that. So patient in Maryland received care, treatment, medication, and that provider bills a carrier. Say the carrier is in Texas. Are there provisions to protect the release of that information to any authority in Texas? Because Texas law says that anyone who knows about anyone receiving abortion care services have to report it. So that's my main concern. And then just want to know if that is protected under this legislation. The technical part of it, I'm not sure.
It would be. The only purpose that in your scenario that would be allowed is just for claims adjudication. They wouldn't be able to turn over that information for another purpose. So if it's requested, they wouldn't be authorized to do that.
Okay, great. Thank you.
Thank you. Are there, Senator Reedy?
If there's an emergency situation, like someone's in another state and they're trying to find their medical history, just how does it deal with that?
So this is,
The other bill I know we have on the list deals with like criminal proceedings, but this bill doesn't, this is nothing about that, right? So this is all health related.
right. So this would still, this would permit a disclosure if the patient had authorized the transmission of that information. So information could be shared for the purpose of treatment under the bill. It really does provide for that.
So woman has come here from another state, has an abortion, abortive procedure, returns to her home state, 2 months later has an issue that the doctor would just ask, is that gonna be like a normal form? Or are they gonna know to do that? I guess that's my only question with, I have more questions, but this is just the one question I wanted to ask. I mean, is it?
Yeah, so I don't think it would preclude being able to access information
Okay.
under that emergency scenario.
Okay, thank you.
Okay, additional questions? Questions with the amendment or reprint? Okay, I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable on Senate Bill 786 as amended. Seeing no questions, all those in favor, raise your hand. Okay, those opposed, raise your hand. That bill passes on is that 8-3, favorable with amendments. Next bill.
And so the next bill is a bill in which this committee is second, and the Judicial Proceedings Committee has approved this bill yesterday. This is the Reproductive Health Protection Act. And what this bill does is it generally establishes protections relating to shield patients and providers from interstate investigations concerning legally protected healthcare services that are lawful in this state. And so going through the bill, it would, on page 3, it prohibits the issuance of court orders and subpoenas relating to legally protected healthcare. On page 5, it prohibits ex parte orders relating to wiretaps and electronic surveillance concerning legally protected healthcare. There's an amendment that was adopted that makes clear that order can be issued if the acts forming the basis for the investigation or recovery of evidence would constitute a crime in this state. There are provisions that prohibit enforcement of judgments from other jurisdictions concerning acts that in connection with any litigation that's concerning legally protected healthcare, unless the underlying cause of action is based in tort, a claim for which a similar or equivalent claim would exist in this state and brought by the patient who received the legally protected healthcare or patient's legal representative, or that is based on conduct that would be prohibited under the laws of this state. The bill prohibits extraditions relating to legally protected healthcare. It prohibits healthcare providers from being disciplined by a Maryland Health Occupations Board for the provision of legally protected healthcare, if provided in accordance with the standard of care. A board here also may not discipline a provider here if disciplined by a board in another state for providing legally protected healthcare that's provided in accordance with the standard of care in our state law. There's an insurance provision in here that clarifies that insurance coverage requirements for abortion care services apply to high deductible health plans unless the insurance commissioner determines that the coverage requirements are not allowed under the federal tax laws governing these plans. And there's a there's a part of the bill that prohibits a medical professional liability insurer from taking an adverse action against a provider for providing or making a referral for legally protected healthcare. They couldn't, for example, raise their rates. There's an amendment here that clarifies that an adverse action doesn't include a rate filing in accordance with state insurance law. And then finally, the last part of this bill restricts the use of state resources to support out-of-state investigations of legally protected healthcare.
Hey, are there any questions on the reprint? Okay, I'll entertain a motion.
Move favorable, second.
Have a motion and a second for a favorable. Senator Lamb?
A question for council. I know we have a bill that's also on this vote list later dealing with gender affirming treatment. The provisions here for legally protected healthcare services, does that include or not include gender affirming treatment?
It doesn't. It does not. So the definition of what's covered under this bill is on page 9 of the bill. And in here, legally protected health care means all reproductive health services, medication supplies related to the direct provision or support of the provision of care related to pregnancy, contraception, assisted reproduction, and abortion that is lawful in the state.
Okay. I mean, it gives me pause because, you know, particularly if we're going to pass this other bill, Senate Bill 460, that would provide for gender affirming care, to not have that also protected under this provider shield bill seems like an issue that, you know, would leave something outstanding for consideration later on. So, you know, I'm not going to hold up this bill, but it does just give me some concern there with this. Particularly since, you know, we still have compacts that are ongoing, that are still in effect. And we actually have compact bills that are still coming up before us. And it just, I think I mentioned this before during those prior hearings, that I have a lot of pause with compacts right now in this post-Roe environment that we're in. And when bills don't fully offer all of the protections that are needed for legally protected care that should extend to gender affirming care, if that bill were to pass, it seems like we're just missing a piece of it that is really important. So I just wanted to voice that.
No, thank you for that. And yeah, so we're secondary on this bill to JPR and they don't have that other bill before them. So, but noted, your comments are noted. Any further questions or discussions? We have a favorable with amendments and a second before you. Are there any additional questions? All those in favor of Senate Bill 859, nope. Is that the right bill? Yes, 859 with amendments, raise your hand. Thank you. Those opposed, raise your hand. That bill passes 8-3, favorable with amendments. Thank you, Patrick. Next bill.
Oh, okay. Senate Bill 876. If we flip the page over, the next bill is the bill that we heard yesterday. This would establish a Baltimore Regional Transit Commission. There are some amendments here from the sponsor of the bill. What this commission would do under the amendments is it would provide input and engage in advocacy for the Baltimore region public transit systems maintained by the Maryland Transit Administration. If you go to page 4 of the bill, you can see what some of the duties are of this commission. It has a role in reviewing certain reports, such as this annual attainment report that the MTA puts out. It would review and comment on service change reports, major service change proposals, the administration's annual operating and capital budget request. It would review and approve an update to the Central Maryland Regional Transit Plan. It would review and comment on the capital needs inventory report, and then review local transit plans and services in the Baltimore region to ensure coordination between the local transit services and MTA. The amendments make some changes to the composition of the commission. Legislative members would be struck under the proposed amendments here. The number of members from Baltimore City would be changed from 4 to 3. I'm sorry, not the total number. There would be 6 members from Baltimore City, but 3 would be appointed by the governor, and 3 would be appointed by the mayor. Then there would be 4 members from Baltimore County, 2 of whom would be appointed by the governor, and then 2 who will be appointed by the county executive. There would be 2 members from Anne Arundel County, 2 members from Howard County, and 1 non-voting member who is an employee of the MTA and is a member of the Amalgamated Transit Union Local Labor Union, designated by the union. And then the bill provides that the secretary or the secretary's designee, who would only vote in the case of a tie. So the commission would be staffed by the Baltimore Metropolitan Council, and MTA must allocate funds for operational expenses incurred by the commission, including funding for 1 senior planner and 2 junior planner staffing positions. On page 4, I did review the duties of the commission already. And then on page 5, we just have a provision here that says, in carrying out its duties, the commission must endeavor to ensure that MTA's plans, budgets, decisions, policies, goals, priorities, operations, services address the needs of residents and businesses in the region. And then amendments on the last page just make some modifications to the staggering of terms to reflect the changes of the composition of the commission.
Hey, we have before us Senate Bill 876 in reprint amended form. Are there any questions? Senator Mounts.
Is there any remaining opposition?
No, there's no opposition.
Right. Thank you.
Actually, I take that back. I think we've been having this happen a lot where an individual will sign up and just indicate that they're opposed with no information or affiliation.
But I was more interested in like some of the transit organizations, things like that,
No opposition from those types of groups.
government agencies.
No.
Thanks.
Senator Reedy.
It
And
is
then
true,
Hershey.
MDOT does not support the bill. They gave us information, correct?
Right. I mean, they did not come in opposed to the bill. And this was I think this is the product of a work session that happened, a working group that happened over the summer.
So does the administration's okay with this?
That's my
The governor?
understanding. Yeah.
Well, the only reason I ask is that in their letter, they talk about how BMC already has meetings, but is this literally going to as I was looking at the bill and maybe I didn't understand all the amendments, is this going to now MTA has to get this group's approval for their transit plan?
So this group is largely providing review and comment. It's providing review and comment
Review
on these plans. And the Baltimore Metropolitan Council, as I understand it, was working with the proponents to come up with these amendments so that they would be comfortable with this.
It's a very complex board. Okay, thank you.
Senator Hershey.
Thank you, Madam Chair. Just, I'm sorry if I missed it. Is this now in the exact same posture as the House bill?
It is, except for the one difference is that the sponsor is is also including this amendment that would strike the legislative members. That's the one difference. So all these amendments were adopted by the House except for that one piece.
All right, thank you. Yeah, sorry, thank you.
Gee, all right. So we have before us Senate Bill, Senate Bill 876 and reprint with amendments. I'll entertain a motion.
Move favorable.
Okay, and Senator Ellis seconded. I have a motion and a second for a favorable as amended Senate Bill 876. Seeing no questions, all those in favor, raise your hand. That's 8. Those opposed, raise your hand. That bill receives a favorable with amendments 8-3. I think, thank you, Patrick.
2 more.
2 more.
Mhm.
Okay. We keep trying to send you away, but
So Senate Bill 928, this is a bill that relates to reinsurance. It makes a technical change to the credit for reinsurance model law. It expressly prohibits the insurance commissioner from removing a reciprocal jurisdiction, which generally means a jurisdiction that's part of a certain international agreement, from the list of jurisdictions authorized to operate in the state without the need to post collateral. The testimony was that there is this international agreement that's been entered into between the United States, the EU, and the UK that eliminated reinsurance collateral requirements as a condition of a domestic insurer's receipt of credit for reinsurance for these reinsurers. And there's the National Association of Insurance Commissioners revised model law reflects this international agreement, and that the bill from the testimony from the insurance commissioner is needed to conform our law to that model.
all right. Are there any questions on this bill, Senate Bill 928?
Second.
Have a motion and a second for a favorable on Senate Bill 928. Seeing no questions, all those in favor, raise your hand.
No amendments.
I'm assuming Senator Reedy, since you second, you're good. Okay. That bill receives a unanimous favorable report. Senate Bill 928 passes unanimously.
And Senate Bill 929, this renames the Office of the Commissioner of Financial Regulation under the Department of Labor as the Office of Financial Regulation. It also establishes the position of Deputy Commissioner for Non-Depository Activities and renames the existing Deputy Commissioner role as the Deputy Commissioner for Depository Activities, which reflects its current role in the office. There are no amendments.
Hey, you have before you Senate Bill 929.
Move favorable.
Have a motion and a second for a favorable on Senate Bill 929. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. And thank you, Patrick. You're done? Okay, thank you so much. All right, we're going to Nathan next.
The next bill on the list is Senate Bill 460, which requires Medicaid beginning January 1, 2024 to provide coverage for gender affirming treatment. By December 1st each year, beginning in 2024, each managed care organization must submit a specified report to the Department of Health. And by January 1 of each year, beginning in 2025, the department must compile an annual report on geographic access to gender affirming treatment across the state. The bill expresses the intent of the General Assembly that Medicaid provide gender affirming treatment to all Medicaid recipients for whom gender affirming treatment is medically necessary. There is an amendment reflected in the reprint, which alters the MCO and MDH reporting requirements to make being included in the report optional for providers.
Hey, you have before you Senate Bill 460 in reprint form with amendments. Are there any questions? Senator Reedy.
Thank you, Madam Chair. Nathan, so the amendment, when they decline to be identified, I know it's for a safety issue, correct?
That's my understanding of why the amendment was offered by the bill's sponsor.
We would still be able to get the data on these procedures. It's just about whether their names are.
Correct.
We had a discussion offline, a couple of the members and I talking about this issue. There was a question about what's included, and of course it's listed in the bill, but hormone therapy and hormone blockers and puberty blockers are all included in there, correct?
I believe so.
Does
Yes.
Medicaid already cover that or no?
So information about the types of gender affirming treatment currently covered by Medicaid is included in the fiscal and policy note. Let's see. My understanding is that yes, hormone therapy is required and is covered, and in fact, I believe under the current paradigm required for a 12-month period ahead of.
I see that in the
Sure.
fiscal note now. So the fiscal note lays out currently Maryland Medicaid covers gender affirming treatment for individuals that are 18 and older, have the capacity to make fully informed decisions to consent to treatment, have a diagnosis of gender dysphoria, and undergo a minimum of 12 months of continuous hormone therapy, which you talked about when recommended by a mental health professional. That actually excludes mastectomies, but for everything else, the individual also has to have referrals from mental health professionals. Let's see, and the following treatments are currently reimbursable by Medicaid: outpatient therapy, mental health services, and there's several other things listed, including hormone replacement therapy and gender reassignment surgery. So we already cover a lot of things. So what does this bill change about what we just talked about?
So the next paragraph on page 3 of the fiscal and policy note lists certain services that are not currently covered. Additionally, the bill includes provisions related to statements like on page 4 that the program, if adverse benefit determination is going to be issued in a certain way, then there needs to be an appropriate review of that. The program may not deny or limit coverage for gender affirming treatment based on the program recipient's gender identity. These are other provisions that are going to be codified under the bill.
Okay, and then it adds in the things listed. But what's not clear to me and what's already covered is our hormone therapies, but puberty blockers currently covered by Medicaid, because you wouldn't need a puberty blocker because you'd be over 18 under the current law, correct?
I don't know the specific answer to that question.
I guess my question is, what's changing? As I look at the bill, I have a concern about, and I don't know if we need to adopt the amendments, Madam Chair, first, or
If we could adopt the amendments that are
Yeah,
before us,
sure.
and then if there are additional amendments, they would be to the reprint, right?
Yeah.
Okay, so we have a motion and a second for a favorable on the amendments to Senate Bill 460. Are there any questions? I forgot now. Oh, maybe I didn't do that yet. Okay, Senator Lamb, Senator Hayes. Okay, have a motion and a second for a favorable on the amendments to Senate Bill 460. Seeing no questions, all those in favor of the amendments, raise your hand. And that's 8. And those opposed, raise your hand. That's 2, 8, 3. Those amendments are adopted, so you now have the amended 460 before you. Senator Reedy.
So I just want to make sure we make it abundantly clear that this is for adults. So I think, this has to be somewhat conceptual, with apologies to a couple of my colleagues that have mentioned this, but we don't like to do conceptual amendments, but I think that if it was on page 2 of the reprint, I don't know if it would be under 15-151 or just above 15-151, but you could put something just to make it very clear that we're talking about individuals 18 and older. And the reason I offer that, Madam Chair, is I think we want to be pretty careful. There's a number of changes taking place, and a lot of folks are very concerned about. We've had several European countries, for example, that were very aggressive in treating children for gender dysphoria and prescribing these kinds of changes, puberty blockers, other types of surgeries even, and a lot of them are pulling back. England, Finland, Sweden, even France is looking at they've all pulled back and are now restricting those because they're just not sure. They're seeing a lot of surge in demand and they're concerned about the long-term effects of doing things that are either irreversible or very difficult to reverse on children. So I don't know if this bill already, I don't know as drafted, if this bill would take away the restriction that's currently in our law about you have to be 18 or older for Medicaid to cover. Is that, Nathan, that's why I'm asking. I just think we ought to make it clear that for now, we should keep it 18 and older.
The bill doesn't have any provisions in it related to an age requirement.
Okay, so if the bill's silent on it, that means that we're not changing the current policy?
So generally under the bill, coverage is tied to medical necessity. And it doesn't have or make any changes to the current law related to the age of consent. So there are other provisions in current law, specifically Health of General 20 I believe it's 102, that lays out the instances in which a minor has the right to consent to treatment. And there are a number of specific scenarios included there, including treatment or advice about drug abuse, treatment or advice about venereal disease. So some of that is covered in current law.
Right, but they can consent without parental involvement, but these services, they would not be able to, correct?
There's not, there's no change to 20-102. There's nothing added to that provision about gender affirming care. And there's nothing in the bill related to an age of consent.
Okay. I'd still like to offer an amendment just to make it clear that we're not going to, we're talking about Medicaid taxpayer funded dollars. We're not talking about whether somebody can go get this, but in this case, I think we need to be, I don't think we want to be getting into right now minors in this bill. So I would just ask for that to be added to the bill. And I understand I understand we need to move it, or I don't know that we need to move it, but I know there's pressure to move it. So, I mean, there's a desire to move it from some. So I think it'd be a comfort level for a lot of people when we're talking about taxpayer funded particularly, but also I think, again, like I said, I mean, I literally can send you the articles. I mean, these are not like, this isn't, we're talking about, Oklahoma, we're talking about France and Sweden. In Australia in 2003, the main hospital in Melbourne, Australia that deals with these kind of issues treated 3 children. Now they treat over 200 a year in just one hospital in Melbourne, Australia. It's all over the world. There's this concern that there's this surge. We just heard earlier today about diet pills and body images and social media driving body image issues. There's just a lot of concern about it for kids, for doing things beyond counseling, beyond other types of treatment, things like puberty blockers, things that make major changes. So anyway, said my piece. I'd feel a lot more comfortable with having that in there.
Senator Hershey?
I would just support that again. It's difficult sometimes when we're creating policy to go back and look at different sections of the bill that or article that are not directly reflected. But again, if Maryland Medicaid does state that these that they cover gender affirming treatments for individuals that are at 18 and older, I think we should just confirm that in this legislation as well. That's from the fiscal note, page 3.
Yeah, I'm just following your conversation, I guess, and I'm assuming that was a motion in a second. I'll go to Senator Hayes before I ramble. Senator Hayes?
Madam Chair, I was just asking conceptually, since this, like far as process wise, so the senator is asking if we could conceptually consider amendment. We don't have an amendment in front of us. So I wonder if, as opposed to taking an official vote, we could conceptually vote this amendment down. But if we did conceptually vote it up, that it would be offered maybe by the committee. I doubt that we vote for it, but I'm just saying, can we take a conceptual vote as opposed to because we don't have an amendment to consider in front of us.
Okay, hang on. I'm going to go to Senator Hershey and then, yeah.
I would just then state, because again, I think that we can all recognize that this is at least it should be current law as far as what Maryland Medicaid covers, right? And if there's an opportunity that this isn't going to be voted on and there's not enough information that's provided, then I think we should hold the bill until a proper amendment can be drafted in order to do this. I mean, I think the concept is simple, but I agree. We've gone around here a few times and not and held bills because an amendment was not drafted. But again, I think this is just confirming what is already in place, but just not written in this law, in this bill.
Thank you, Senator. I think I heard council say that is an existing law, so the amendment wouldn't be necessary. If we need to pull down a code book and take a look at it and make sure that it's there, but I think the fiscal note clearly referenced where it is, but I hear you and I hear you with not having an amendment before us. I'm going to go to Senator Lamb.
All right, well, I'm not sure if I'm speaking to a conceptual amendment, an amendment or no amendment, but you know, I think you know, I just want to reflect on some of the things that have been brought up, which are that, you know, to be clear, this is really just for medically necessary treatment. And I think you know, that medically necessary part is important because it's something that's determined by a provider who is working with that individual, with that patient, and it is tied to current medical standards. And I think it's also important to be clear that MDH already covers care for adolescents. So adolescents already qualify for care under MDH if they require gender affirming treatment. So I don't know if that, again, is speaking to which part, but just wanted to make sure that that was clear to folks.
Senator Reedy?
Yeah, thanks. So we talk about standards, is it talk about the standards that we're meeting and applying to this too? Are we just saying that right now MDH gives puberty? When you say Maryland Department of Health, Senator Lamb, if you don't mind, me ask a question. I mean, so are you saying that right now minors can receive what you're calling gender affirming care? I don't know that I call alterations to a voice box to be life-saving medically necessary care, or alterations to like hair removal, which is listed in the bill, is necessarily life-saving care. I guess it could be considered gender affirming. Is that happening with minors? That's happening with minors now, but Medicaid is not paying for it, correct?
Medicaid is paying for it if it's determined to be medically necessary by the provider.
How could hair removal be medically necessary?
I mean, I think it's hard for us to adjudicate. We don't have a patient in front of us, and that's really why we as a body generally defer to providers on standards of care. And so this would be no different.
Isn't that so? Right.
Sometime I'd love to debate when we've started changing what's medically necessary and what it's based on. But we don't want to get into that debate probably in the middle of trying to vote a bunch of other bills.
Yeah.
So we can't do a conceptual amendment adding
Well,
18?
the senator said that he was willing to take a conceptual amendment. So is there any opposition to voting on this amendment? Okay, we had a motion and a second for a favorable on the conceptual add 18 years of age to the bill. Yes.
Be specific, we are just placing in this bill what is already in state law. Is that accurate? With 18, that was the question.
That was the proposal.
Right.
That's the proposal.
That's the real question. So if it's in state law already, in the other health general article, that we are just making sure that it is in here as well.
That is what is proposed in this conceptual amendment. That is my understanding. Go ahead, Senator Reedy, then Senator Ellis.
So does council agree that that's what we're doing?
So there's a limit to how specific I can be. The fiscal and policy note says that the current Medicaid policy is to cover gender affirming treatment for individuals that are aged 18 and older.
Okay.
It doesn't cite to the specific source of authority.
Okay. So then the amendment is just to simply
Reconfirm what's in the
reconfirm
health
that,
article.
since we're making a pretty major change here.
Senator Ellis, then Senator Guile.
Yeah, thank you, Madam Chair. So I would like to ask the conceptual amendment sponsor. I would like to ask the conceptual amendment sponsor if I could offer conceptual amendment to your amendment to put in, except with the parental guardian consent. All conceptual, of course.
Yes.
I would say when we're talking about Medicaid funding, and I'm not sure if you'll vote for it, maybe I'll do that if you'll vote for it.
Well, no, I'm just want to know if you could accept that consent.
Well, that'd be changing. It sounds like it'd be
Your
changing
conceptual
Medicaid.
amendment.
It sounds like it would be changing Medicaid policy, so I better not suggest that.
Okay, thank you.
Did you get your answer? I apologize. Oh, he wouldn't accept that as a friendly amendment.
He didn't volunteer to vote. It's Medicaid policy apparently, so I can't accept that.
Senator Guile. Jim.
Thank you, Madam Chair. I guess with all due respect to the maker of the conceptual amendment, as well as to Senator Ellis's conceptual amendment to the conceptual amendment, but I would feel more comfortable voting on something if I saw it written in front of me. I think I understand what both senators are proposing, but I would personally feel more comfortable seeing something written before voting on it.
And that is the second request for hold, so we're going to honor that, and this bill will be held. Okay, next
102.
bill. Nathan?
Next bill is Senate Bill 506. This is a bill that's back again after being held yesterday. This time, the sponsor has withdrawn the requested amendment, and as a result, Senate Bill 506 authorizes the town of Forest Heights in Prince George's County to undertake urban renewal projects for blight clearance by exercising the power of eminent domain to acquire properties in blighted areas that are zoned for commercial purposes. The town may not initiate an urban renewal project unless its legislative body adopts a resolution that defines the area and finds that rehabilitation or redevelopment is necessary and in the public's interest.
Yeah, I just wanted to mention, I did follow up with the delegation yesterday. We had an amendment before us. The sponsor withdrew the amendment. The delegation continues to support the bill as introduced. So, any questions? Thank you. Have a motion and a second for a favorable. Was that your thumbs up? Was it? Oh, that, okay. Yeah, that's a second on whatever bill number that is that we're on. Senate Bill 506. Senate Bill 506, Town of Forest Heights. Are there any questions? All those in favor of the favorable, raise your hand. That bill receives a unanimous favorable report. We'll move to the next bill.
Senate Bill 558 establishes a recovery residence grant program in the Department of Health to award competitive grants to recovery residences to support operations, services, and programs. This bill has some amendments and is reflected in the reprint before you. Beginning in fiscal 2024, the annual budget must include an appropriation of $500,000 for the program. And by December 1st, 2024, and annually thereafter, MDH must submit a report to the governor and the General Assembly that includes specified information. The amendment expands the levels of recovery residences that may apply for a grant under the program. It ends the mandated appropriation in fiscal 2027, modifies the requirements that a recovery residence must meet in order to qualify for a grant, and then authorizes the Department of Health to establish additional qualifications by regulation. There was no opposition at the committee hearing.
And are these amendments in this reprint or these separate?
The amendments that are on the back are the ones that are reflected in the reprint.
Okay, so you have before you a reprint with amendments of Senate Bill 558. Are there any questions? I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable on Senate Bill 558 as amended. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable with amendments report. Nathan, last bill.
Next bill is Senate Bill 581, which establishes a behavioral health care coordination value-based purchasing pilot program in the Department of Health. The purpose of the program is to establish and implement an intensive care coordination model using value-based purchasing in the specialty behavioral health system. So the Department of Health must administer the pilot program, which must be operational for a 3-year period beginning in fiscal 2025. For the 3 years that the program is operating, the governor must include an appropriation of $600,000 for the program, and the department must evaluate the effectiveness of the program by analyzing specified healthcare utilization data, health outcomes, and clinical quality metrics, including patient experience measures. The department reached out this morning after the voting session yesterday to clarify their position and has stated that MDH is comfortable with the provisions of Senate Bill 581 and that they believe that under the language of the bill, the department would have the latitude to appropriately scope the pilot and set additional criteria for provider participation, including quality and cost targets.
Okay, I have a motion
Second.
and a second for a favorable on Senate Bill 581. Are there any questions? All those in favor of the favorable, raise your hand. That's unanimous. That bill will receive a favorable report. Thank you, Nathan. We'll turn to David's list.
The first bill, if you flip your yellow page over, you'll see the first bill on the is Senate Bill 2, which was heard a very long time ago. This bill concerns, I'll just go into it. You have a reprint. It's been amended a lot. And some of the amendments come from Senator Kramer's SB 401, which he withdrew. As amended, it becomes an emergency bill that includes elements of Senate Bill 401 and requires the Department of Human Services to develop a process and to reimburse a beneficiary for an amount of benefits lost due to the fraudulent use of the beneficiary's electronic benefits transfer card. The bill also specifies requirements relating to the procurement process for electronic benefits distribution or administration. The amendments to the bill were developed along with the Department of Human Services, so they worked with the sponsor and Senator Kramer to come up with consensus amendments that can allow for the replacement of these benefits as well as create a circumstances where people can get new EBT cards, which may be more secure. You have a reprint in front of you. I'll go through it very quickly. If you go to page 2 of the reprint, you'll see that there's definitions added in the bill. These are all from Senator Kramer's bill. If you go to the bottom, it specifies a process for restoring lost and stolen benefits to beneficiaries, which would include SNAP and temporary cash assistance. If you go to the next unnumbered page, you'll see here that they're at the top, that this restores the benefits that they determined that they can have their benefits restored. And also it would provide these individuals with a new EBT card. The department also, as part of this restoration process, may not require a household to provide a police report as a condition of receiving the benefits. If you go further down on the new language here, it establishes an appeals process if an individual is denied a restoration of benefits. And at the bottom, if federal funds are not available, in the middle of the page, if federal funds are not available, then state funds may be used to provide these lost benefits. The rest of the original language of Senate Bill 2 is struck. So if you go to page 3 of the reprint, you'll see that there's new language added that the department shall coordinate with vendors to take available precautions to make sure these EBT cards are not vulnerable to theft. There's no requirement in here that they have a chip, but they just have to take proper precautions, and they'll be working with the vendors to come up with a more secure card. At the bottom is a very extensive reporting requirement, which goes to the next page of the reprint. The bill also establishes a benefit theft restitution fund with a one-time mandated appropriation of $2 million. And my understanding is the governor was able to put money into the budget for this purpose. So the money is there to fund this fund. And on the back of the bill, there's uncodified language directing how DHS should work with the vendors regarding new EBT cards and the security of these EBT cards.
Senator Reedy.
Apologize to ask another question, but the one thing I caught in the amendments here, where do these where did the amendments come from? Are they sponsor or are they?
They're from the sponsor. They include some of Senator Kramer's bill that was withdrawn, and also they worked on these amendments with the Department of Human Services.
I guess my one question here is, we're saying it's a theft, right? Which can include physical theft, of course, identity fraud, theft or skimming. How do we know it's a theft if there's no police report? How are we showing it's a theft?
But the fact that they were, when they went, I think the key here is if you go to get your benefits and there's no money there, they must have went somewhere, and that would constitute, and most of the testimony, that's what happened to
Would
these
you
folks.
repeat? I didn't understand what you said. Repeat that.
When they go to use their card and there's no money in there, and they can prove that they didn't spend that money
How can they prove that?
by the use of the card.
Oh, because they could show the card. I didn't use the card.
Yeah, I didn't use the card.
Because I understand with skimming, you wouldn't know either. It's
You
different
wouldn't
than if
know until
somebody
you go
swiped
to
your
the
wallet.
next time to use your card that there's no benefits left.
And if their wallet was stolen, they probably would file a police report or something. Okay. All right. I just was like, it's a little funny. Okay, I get it. Thank you.
Hey, you have a reprint amended version.
Favorable, Madam Chair.
Second.
Have a motion and a second for a favorable on Senate Bill 2 as amended. Are there any questions? All
Yeah.
those in favor of the favorable, raise your hand. That's unanimous. That bill receives a unanimous favorable with amendments.
Okay, the next bill on your list is Senate Bill 299. You have a reprint in front of you with amendments offered by the sponsor and one tweak by the chair of the committee. As amended, the bill requires beginning on January 1st, 2025, that specified restaurants and grocery stores to have an on-site approved automated external defibrillator, or AED. I'll use that from now on. AEDs must be placed in prominent areas and the functionality must be maintained. MIMS and the health department must jointly adopt regulations that establish periodic inspections of these AEDs and provide assistance to the affected restaurants and grocery stores. If you'll go to the reprint very quickly again. The sponsor and his amendments brought in this part of the code that requires a certification for AEDs and programs. This language is brought in, and then the amendments exempt out those facilities and restaurants, these restaurants and you'll see later added grocery stores that would have to have this requirement about having an AED on site. So they would not be subject to these certification requirements by the EMS board. At the bottom, there's a lot of changes to the bill, and there's a definition of AED added by the sponsor. And he brings in grocery stores because apparently under the definition of food service facility originally, it did include grocery stores. So he specifies which grocery stores this would apply to. And you can see that here that they're all major food department, to have all major food departments, including meat, et cetera, and at least one of the major food departments, and at least 10,000 square feet of floor space. And this AED requirement required to only grocery stores and restaurants. And you'll see there's a change here to bring it up to $1 million, which is offered by the sponsor. So if these restaurants or supermarkets have gross sales in excess of $1 million, this requirement would apply to. You go to, you'll see that, again, beginning January 1st, they have to do this, 2025. On page 2 of the reprint, numbered page 2 of the reprint, the sponsors added civil immunity provisions for these folks who have to comply with the bill's requirements. And on the bottom, the existing language is still there, but MIMS providing assistance and grocery stores added.
Okay, you have before you an amended Senate Bill 299. Are there any questions? Senator Mounts.
How are government buildings currently under this requirement?
Or which buildings?
Are government buildings under this requirement?
I think they may be. We have an AED in this building.
But are they required? The county buildings, all municipal buildings?
I have to find out. I don't know exactly who is required. There's part of the code that has that list of who's required in there. There's also been studies done by MIMS about which facilities, you really should have an AED in.
Right. I just know from the past and talking about having requirements, and when you're setting the bar for the private sector, you always got to make sure the government's doing its part also. But so there is no bar, there is no requirement for government buildings.
I don't know for sure, but almost every government building does have an AED in it. So, or access to one.
Okay.
I can provide you to the list later if that's, I'll find out where that list
Well,
is.
then, and then in the inspection, so, when you do with the covered business, they're defined by revenue,
Yes.
right? So how does an inspector know what business is covered? Because the health inspectors, they have no information on the revenue of any of the businesses. So if you go to the health offices, they've got no idea about the finances of any of the businesses they inspect. The health offices, they go into the businesses and they have a HACCP plan. They've got all the scheduled devices, like the things that are regulated by the health department. They have to have a list of those things. But one thing that the health department does not have is financial information on the entities that they regulate. So I guess you're talking about a food service facility licensee. None of the information for any entity that applies for that license submits any sort of revenue information. So how would an inspector, a health officer, one of the line inspectors know which business they're supposed to inspect? And then how would an inspector approach a business to inspect them when they've never been trained or had any instruction on how to do any sort of a revenue analysis on any of these businesses?
The health department wouldn't be doing these inspections. It would be up to the Maryland Institute for Emergency Medical Services. They have to adopt regulations. So I guess the devil would be in the regulations on how they would approach this inspection process.
Well, that would either be done then through the fire marshal's office, or it would either be done through the fire marshal's office, or it would be done through the health office. And neither of those do any sort of financial information on any of these entities. And sometimes, I'm just trying to draw out a little issue with the way this kind of tries to cover certain businesses. But to me, that doesn't really I think it makes it a little convoluted.
All right, the bill doesn't go into that kind of detail. I defer to the sponsor.
Yep, sponsor the bill.
Yes, and the point here is that the department will develop the regulations, and the regulations may be very dependent on self-reporting to the department that the sales are in excess of $1 million. And then the department is in a position to audit to see if, in fact, it has been done and done properly. But the goal here is, and by the way, just if I may, about the bill itself. It has been very much streamlined from what it was introduced. It was a much broader bill, much stricter limitations put in, all of the requirements that we heard concerns about, that it would also require all this additional training and CPR. All of that is out of the bill. That training is not required of anyone in the place of business. So it is a considerably streamlined from where it was, but much of this is going to be self-reporting. There are no penalty provisions in the bill. Nobody gets fined. Nobody goes to jail. That's not the point. The goal here is to ensure that where we have these high volume locations with lots of people coming and going, that the device be provided. And additionally, there is a bill that has already moved through the House, and it's going to work its way through the Senate as well, to provide a $500 tax credit to any of the restaurants that are affected. So,
Yeah. And I think I fully support the tax credit, but I have some serious issues about the way this is designed.
understood.
And
There's,
based off of the structure and the form of the way these licenses are issued and how they're regulated. And I also have a little concern for our health departments, because I've got a hunch they'll be doing the investigating or the inspecting, and they are overwhelmed already with state mandates to enforce regulations and requirements that they have a very difficult time enforcing. And then they get put into situations where the health officer looks like the bad guy. And so, anyway, I'm kind of, isn't that so?
Okay, let me go back to council, then I have vice chair and then I have, oh, that's it.
There is I misspoke. I forgot that this is actually in the Health General article. So both MIMS and the department have to jointly develop these regulations. And there is testimony by the health department that they can do this. They can do this because they already do this for swimming pools and other places that have AED. So they have the resources to do these inspections.
Yeah, they have the resources, but they don't have the ability to determine what's covered and what's not covered, because the way they inspect pools and things like that, it's not based off of the pool's revenue. So anyway, I don't, yeah.
Well, we can take out the revenue limitation on there and just open it up to everybody.
Vice chair?
Why did you put grocery stores in?
They were included in the original bill. So the original bill came in as drafted with food license facilities. Food license facilities are a huge spectrum, everything from convenience stores to grocery stores. And in order to narrow down the scope of the bill to where we get really high volumes of people, we pulled out grocery stores and over 10,000 square feet, so that we're really talking about the big stores. So we were looking to narrow it down where we get high volumes of people. So we just pulled that piece out of the food license facilities, but they were incorporated in the original bill. Yeah.
Okay, are there any additional questions on Senate Bill 299 as amended? Have a motion and a second for a favorable on Senate Bill Senate Bill 299 as amended. The reprint is in front of you. Seeing no further questions. All those in favor, raise your hand. Okay, that is 9. Those opposed, raise your hand. That is 1. That bill receives a favorable with amendments report. Next bill.
Next bill is Senate Bill 509. This was heard actually last week. It requires the Maryland Healthcare Commission, when evaluating the notice of acquisition or transfer of interest of a nursing home, to provide written findings and recommendations to the Office of Healthcare Quality, which licenses nursing homes in the state. The findings and recommendations must include the quality ratings of facilities currently or previously owned by a purchaser as specified, tax identification number of each purchaser, the personal centers for Medicare and Medicaid services certification number, and a summary of the findings and the basis for the recommendations. The Secretary of Health must consider the commission's findings and recommendations before taking action to approve, deny, or revoke a nursing home license. You have a reprint in front of you with 2 sets of amendments. It's all one amendment, but these amendments are offered by the Maryland Healthcare Commission and the Attorney General's office. If you go to page 2 of the amendments, in addition to the items I already mentioned about what they have to collect, the commission will be required to collect this new list of information with all relating to the purchaser of the nursing home and their actions within the past 3-year period. Some of this relates to any findings against any nursing home they've owned, any inspection care reports, any surveys done with corrective action plan. You can read what they're required to provide for any facility this purchaser has had in their, has owned for the past 3 years anywhere in the country. And then if you go to the next full page, page 3 or 4 of the reprint. These are amendments from the Maryland Healthcare Commission, and they specify that a certificate of need is required for any of these nursing homes that are to be acquired. It increases the time frame for the commission to do their work and from 30 days to 60 days. And then there's language on the middle here regarding limiting the number of beds these acquired facilities can keep in each bedroom.
Hey, Senator Beidle.
Thank you, Madam Chair. I understand that as we sit here, there's some work being done for amendments, particularly the one that we just talked about with the number of beds that the nursing home advocates and the MHCC are talking right now to come up with a consensus amendment. So if we could hold this till tomorrow, I think we'll have a different amendment.
Without objection, you have a question?
So, David, is there any public disclosure of this, all this information that the commission will collect as far as the transfer? Is it all information internal or?
I would imagine this information would be made available to the public. I don't think there's anything in here. I mean, any findings against the nursing facility or anything like that would be, would be private information.
Okay, so with public, thank you.
Thank you. So that bill will be held. We'll move to the final bill on our agenda today.
you have two
Nope,
more.
2 more. I was trying to go. Okay.
So you're back to the price gouging bill from the Attorney General's office. You have a reprint in front of you with that looks almost the same as what you had yesterday. And you also have attached to your reprint an amendment from Senator Mounts, which is actually the Attorney General is okay with. And so the reprint is the same. I did restore some language. If you go to the last page of the reprint from yesterday, about the information that the Secretary of State has to put online, since there's no list of items or what's considered goods and services, then whatever is in the emergency order by the governor would have to also, be put on the Secretary of State's website. And Senator Mounts, if you go to pages, his amendment is attached. If you go to the last page of the reprint, he has an amendment to strike 12 through 16, which means that any violation of this act would be an unfair and deceptive trade practice under the commercial law article. And I just got an amendment, which I can pass out, but all it really does is it brings in that section of the code where everybody is subject to unfair and deceptive trade practices, and it would add this part of the code from the public safety article to the commercial law article, saying that a violation of section 14.1304 would also be an unfair and deceptive trade practice, and give the Attorney General, the authority to take action.
More action?
No, we went to current action.
Are there any questions? I see faces. Are there questions on the amendments that we have before us?
Move favorable on the amendment.
Okay, I have a favorable on all the amendments. Any questions? All those in favor of the amendments in their entirety, raise your hand, including the Mounts Amendment. That's unanimous. Now, we have an amended Senate Bill 542 before us. Are there any questions? I'll entertain a motion. Have a motion and a second for a favorable for Senate Bill 542 as amended. Seeing no questions, all those in favor, raise your hand. Okay. Any opposition, raise your hand. That bill receives an 8-2 favorable with amendments.
Okay. And then the last bill on this list is from Senator Guile. This concerns, as introduced, the establishment of a Parkinson's disease registry. There's amendments offered by the senator, which changed the bill significantly, and most of which is designed to address the fiscal note, which was quite high. So the bill would have established a Parkinson's disease registry, but rather than doing that, it strikes all the language regarding that registry and instead amends an advisory council that was established last year and adds to the duties of the advisory council, which you'll see on page 2 of the reprint through page 3 of the reprint. And you can see what additional duties are added to this advisory council, including being able to collect data and work in partnership with federal centers of disease control and other folks to come up with a registry eventually. Going down through, it also requires this advisory council to meet at least monthly. The rest of the bill is struck until you get to the back part of the bill. So if you go all the way to page 8 at the bottom, this is new language. And so instead of a registry, it requires the department in collaboration with the state designated health information exchange to establish and maintain a publicly accessible website that has the following information. You can see the information that would be included in this website.
Favorable.
Have a motion and a second for a favorable on the amended Senate Bill 584 that we have before us in reprint. Are there any questions? Seeing none, all those in favor of the favorable, raise your hand. That bill receives a unanimous favorable report. That's the last on our list today. Please stay tuned. We will either come back tonight or tomorrow morning. Probably tomorrow morning. Or tomorrow morning.